My name is Sam Felton and welcome to Expert Interviews here on Smash the Fat. For you today, you've got a real treat. It's not the usual stuff that we do in terms of weight loss, nutrition and fitness. We're going to be really focusing on gut, microbiota and thyroid health with an amazing doctor, clinical researcher and author of an upcoming book that he's currently writing. It's Dr. Michael Ruscio. How's it going, Doc?
Hey, good to be here. Thanks for having me. I'm great.
Absolute pleasure to have you here. Now, this is something that I've kind of explored with a couple of people, but we've never had somebody that's like a true expert, which you certainly are, because it seems that the research going into microbiota and all things surrounding the gut is kind of the new wave of where people want to research. And kind of with that comes a lot of misrepresentation of the research. And it seems that you kind of, are able to spend your time researching to, debunk anything that might be misrepresented and actually put in effective treatments for people. Is that a fair assessment of kind of what you're doing?
Yes, I think it's a fair assessment. One of the things I've noticed throughout my career is there's always something that's the new it thing. And in watching a few health topics kind of come into vogue and then fall out of vogue, you realize to be a little bit more tempered in your approach and not to jump on bandwagons as quickly. And in this area, I've kind of applied that observation, and I also, this is predominantly what I see in clinical practice. This is one of the major areas that I research through our clinical research, and of course, one of the major areas that I'm writing about. And so there's a lot that we're learning about the gut, and that's great. And I'm excited to share with people things that they can do to improve their gut health, to improve other things like weight or energy or mood or what have you, but also at the same time help prevent people from falling into what may be this over speculation, because there's some, this area is in vogue and everyone's kind of jumping on the bandwagon. And the main thing I want to do on the other side of the coin is prevent people from maybe spending a few $100s on a lab test that's not validated or on treatment that's not really well validated. So to help people really navigate, hey, this is a new, interesting area. What can we do and what might we want to pass on?
Fantastic. Now, as you said, this is kind of like a really in vogue new area of study. So before we kind of get into all of this, how exactly did you become a doctor and how did you really want to focus on this particular area of study?
Well, I initially wanted to go actually into orthopedics, and it wasn't until I was in college until I started having some of my own health challenges. And I went from being a college athlete with a pretty good amount of energy to having really bad insomnia, fatigue, mood dips. I felt like I had all the symptoms of hypothyroid, feeling cold and feeling tired. And I went through seeing a few doctors, and nobody really thought anything was wrong with me, which I'm sure a lot of people can relate to out there, where something is wrong, but you've been to a few doctors and all the doctors are telling you that nothing is wrong. And I eventually found a functional medicine doctor, and it was that doctor that diagnosed me with an intestinal parasite, and it was that parasite that was really at the root cause of all my problems. And so I went into functional medicine from there instead of going into a more conventional practice model because of my own experience. And it's really interesting now to see that, where I'm positioned in functional medicine is where so many people and so much research is going now. So it was great to see that my own experience kind of foreshadowed what would become a really popular and important area of research in the future. So now in clinical practice, this is what I do with my patients. Is fairly advanced gastrointestinal testing and treatment, and the results that we can obtain there are remarkable. But also at the same time, we're trying to advance the field, and we're also trying to make the field more efficient and be better with testing, be able to get patients healthier with less testing, and get patients healthy where maybe other doctors haven't been able to by doing some of this clinical research that we're doing. So that's a little bit about my background, and then kind of how I got to where I am now.
It's incredible how you can kind of go into a course thinking that I'll end up dealing with orthopedic things, and then going into the actual learning, and then you end up doing something that's completely different.
Right.
Like literally different. We couldn't get further away, I don't think. But anyway,
about life, just having the ability to just kind of steer your path, right?
Yeah.
Life events and things that happen to you, definitely.
Incredible, and it's really good. Now, just so, because not everybody will fully understand exactly what the microbiota is. So before we kind of get into some nitty-gritty details, what exactly is the microbiota?
So the microbiota is a term used to refer to the world of bacteria, and typically when we say the microbiota, we're referring to the gut microbiota, meaning the world of bacteria in your gut. There's also a microbiota of your skin, a microbiota of your lungs, a microbiota of your urinary tract. So there's many different areas of the body where bacteria reside, and the microbiota would be that world of bacteria on whatever part of the body it is. So there might be, again, the skin or the gut or the lungs or the urinary tract. Most of what I'm doing in terms of clinical practice and where a large body of the research is occurring is with the gut microbiota. And I'm sure people may have heard in some extent the importance of your gut health for your overall health. And so this is really where the microbiota comes in. Now that we're learning that your gut has such an important impact on numerous parameters of health, we're really looking at this microbiota, this world of bacteria and fungus and other organisms, and trying to understand if this person, just use an example, has a overgrowth of fungus, could that fungus be contributing to their weight gain and their brain fog? And if so, if we treat that fungus, could that lead to weight loss and resolution of the brain fog? So it's really a very root cause issue, and I think that's why there's such an immense interest right now, because people are starting to learn that, boy, if I have this chronic depression, for example, there's a possibility that by improving the health of my gut, the depression will go away, and I won't need to rely on an antidepressant or try to combat the depression with things like meditation or positive thinking exercises or caffeine or what have you.
Yeah, it's incredible the impact that it has. And I'm totally spitballing here, but I read a statistic that we're like 90% bacteria or something.
Yes, we contain more bacterial cells than human cells, and we contain more bacterial genes than human genes. Some of those figures have been questioned slightly, but I think it's safe to assume that there's a whole world of bacteria inside of us that may outnumber us. And it's actually interesting because part of the reason why there's so many bacteria in the gut is because we have a very symbiotic relationship with these bacteria, meaning there might be certain foods that we can't digest, or there might be certain chemicals that we can't detoxify, and we allow bacteria to live inside of our guts that assist us with that. And these things are quite marked, where if you look at the bacteria population of Africans, you will see different bacteria than Westerners, and those bacteria are probably there to help them break down their diet. And the same thing even happens with those from Japan. With a higher soy diet, it's been shown that they harbor bacteria in their guts that help them break down and metabolize soy in a healthy way that many Westerners don't have. And this kind of pulls on the string of why we shouldn't make universal dietary recommendations, meaning saying everyone should eat the same diet, because to take the Japanese example, they have these bacteria in their gut that help them thrive on a more native or traditional Asian diet. But if we look at those Asian populations and we take their diet and we put it into someone from Europe, we may not see the same benefit because the bacteria are not present to help them digest and absorb the food properly. So I hope I'm not getting too deep there with the concept, but it's really interesting to see that different populations around the world that have evolved on different diets have bacteria that have evolved with them to help them thrive on that given diet.
Yeah, and that kind of completely makes sense in terms of the theory of evolution and things, adapting to your immediate environment, essentially.
Exactly.
So diet is obviously a massive factor in terms of what type of cultures that you're going to have inside your gut. And are there particular diets that are more harmful or more that are kind of more helpful?
Well, you ask a really interesting question, and it's a deep question, and maybe
it's as broad as you get.
Yeah, I'll give a short answer here, and this is maybe a good opportunity for me to mention that we will be doing a 2-day event in London where we're going to expand on this. So if people listening want more information, I'll be in London January 16th and 17th, along with Melissa Hartwig, who's the author of The Whole 30, and we'll be doing a 2-day event there. And if you're a healthcare practitioner or a doctor, we'll also be offering continuing education credits for that event. And if you just search for Refined Health and Michael Ruscio, you should be able to find that. And I'm sure you'll have the links. But I just want to mention
if the folks at home, either listening or watching, if you go to smashthefat.com/refind, that's REFIND, that'll take you straight to the website where you can find out more details.
Thank you. Yeah, and so we'll definitely be elaborating there because there's these nuances that are important to discuss. So is there one diet that's, or certain dietary practices that are good or bad? There definitely are certain items that are not helpful. And these tend to be things like processed foods, which I think everyone probably knows and can probably agree upon. There's nothing really new or terribly exciting there. Artificial sweeteners, while the data is not conclusive, it seems like the artificial sweeteners do tend to have a negative impact on the microbiota. And what's interesting about artificial sweeteners, again, while the data is not conclusive, some preliminary data shows that certain people will experience a disruption of their gut bacteria after consuming artificial sweeteners that seems to correlate with weight gain. What's even more interesting is if we take those bacteria and we take them out of a human gut and transplant them into a mouse, we see the same negative metabolic consequences of weight gain and prediabetes occur in the mice. And it doesn't happen if we take the gut bacteria from just regular humans that were not consuming artificial sweeteners. If we take the bacteria from humans not consuming artificial sweeteners, put those in the mice are just fine. But in people that are consuming lots of artificial sweeteners, it seems to skew the bacteria. If we take those bacteria and then put them in mice, those mice then develop metabolic problems like insulin resistance, diabetes, and weight gain. So that's really interesting, and that really implicates the microbiota in some of this. Another area that's really interesting, and probably something that's more of a concern to people, is carbohydrate content. There's definitely debate out there as to should you be low carb, should you be high carb, should you be ketogenic, should you be eating safe starches, and it's become even more confused now because some of the research that we're getting comes from hunter-gatherer type African tribes, and we go over to Africa, we study their diets, we study their guts, we find they have what we think is healthier bacteria, and they also have a much higher carbohydrate diet. And so oftentimes the recommendation is us as Westerners, Americans, Europeans, what have you, we should now eat a higher carbohydrate diet to try to have guts like the Africans. And that can really confuse people when these things are not done in a judicious or a cautious fashion. And some of the important things that are left out of that dialogue are that the Africans eat about half the calories that us Westerners eat, and they had much more physical activity. And part of the reason why they have more bacteria is because they're in contact with dirt and animals all day, which gives them this inoculation with bacteria. So, and this is one of the things that we'll be kind of detailing in the seminar, which is just because we see some of these findings in Africa doesn't mean we can force that approach into a Westerner. Mm-hmm. There's another example here, not to give you too long of a run-on answer, but in other African populations, we see a high level of one bacteria that will actually cause constipation and can cause weight gain in Westerners. And this is a bacteria that we oftentimes test for in the clinic. And when we treat this bacteria, we can see very nice resolution of constipation, of bloating, and we can see people experience weight loss and improvement in blood sugar and even cholesterol levels. And there's even some preliminary published data that reinforces that. And so this is why I'm very excited about the research and the work that I'm doing. Is I'm trying to help people and or clinicians cut through, what should we do? Because the Africans are generally skinnier than we are. Does that mean that the bacteria in the gut hold the key to that? Or do we have to be more careful with how we apply that? So there's a lot of interesting factoids, and knowing how to navigate through those properly is really important. I think a simple message people can take home with them is I would start for a short period of time, maybe a month or two, on a lower carbohydrate diet, maybe about 30 days or so, or 60 days on about 100 grams of carbs a day, and give that a little bit of time, see how you feel, and then slowly increase your carbs, maybe up to about 200 grams a day over the course of a few weeks, and see if you notice you feel better or worse on a relatively lower carbohydrate diet or a relatively higher carbohydrate diet, because different people will have different abilities to break down and metabolize carbohydrates differently. So that's why it's important to go through this practice of determining where you fall on the carbohydrate intake spectrum.
Absolutely. And you were mentioning earlier about tests, because some tests will be useful, some not so much. Are there any particular tests that you can do to kind of find out where you might be on that carbohydrate spectrum?
Well, for the carbohydrate spectrum, that's a fairly easy test to do. That can be something like a fasting blood glucose, which people have probably had if they've done a yearly checkup with their doctor. So that's a very routine blood test that can tell you what your blood sugar looks like. Potentially doing a fasting insulin can also help with blood sugar. But those may be a little bit slower to change. What I like people to do to determine their ideal carbohydrate intake is to just go through the exercise of starting low and then slowly increasing upward to see where they feel best. And usually where they feel best is where their labs are going to look the best. But there are tests that one can do to see if they have overgrowths of bacteria or imbalances in bacteria. And there are breath tests, there are stool tests, there are blood tests, there are urine tests. There's an array of tests that can be used, and a really important concept is trying to do the testing efficiently. And I'm not sure if this is something that you've heard of, Sam, or that is coming to your radar screen or your audience knows about, but sometimes in the functional medicine field, the testing can be a bit cost prohibitive, where a patient reports to a doctor's office and the doctor wants to do $3,000 of lab work on day one because they want to be very thorough. And while I appreciate the desire to be thorough, that is not very cost effective, and it can create a lot of financial stress for a patient, and it can also make this type of medicine very restrictive and not allow it not allow access to people that don't have a lot of financial resources. So one of the things that I'm a big proponent of is trying to not do all the tests, but do only the couple tests that are the most relevant, that are going to produce the most clinical change. And so that's one of the things that we'll be going through in the seminar. Is a patient comes in, or you're a person with X, Y, or Z complaints. Out of all these tests we have available, what might be the one or two that are most likely to diagnose the underlying root cause?
Amazing, because it's a huge field with so much scope that, you know, as you say, you can have every single test under the sun, but it's going to cost you an arm and a leg. So yeah, not everybody has a spare arm and leg to pay off the lab for those blood results,
right?
Those bacteria results. And yeah, it's great that we've got somebody like yourself that can kind of decipher that. And you know, with that in mind, that as we said, there's a huge scope, and we don't have enough time here today to go through that. So if you do want to find out more on those specific tests, and particularly if you have any gut problems yourself, you can come to Dr. Ruscio's seminar in London on the 16th and 17th of January. I believe yours specifically is on the 17th, but you're also helping out with Melissa on the 16th as well. And again, people can go check that out if they go to smashthefat.com/refind. That's REFIND. Not refined like refined foods, but refined. Yeah, absolutely. Now, something that we haven't touched on yet is thyroid health. And obviously that's kind of something that is quite well known, I think, in the public. People hear about hypothyroidism. I'm sure people have got, you know, maybe one or two friends that have got hypothyroidism. So what exactly causes that, and how can you try and treat it?
Well, certainly, you know, with one of the things I think that your audience is very concerned about with being fat or weight loss, thyroid often comes up in that dialogue. Mm-hmm. And you know, certainly thyroid can be implicated in weight gain, but sometimes thyroid is also overly blamed for weight gain. And we did do a through my podcast, we did record a pretty comprehensive review of the impact of thyroid on weight, and also what thyroid treatments can what different types of thyroid treatments can affect for weight. So you know, hypothyroidism in Western countries is predominantly caused by thyroid autoimmunity. This is Hashimoto's disease predominantly. There's another type of thyroid autoimmunity called Graves' disease, but this is a condition where your body is attacking your own thyroid gland, and this can cause you to become gradually hypothyroid over time. What's really interesting here is that the gut holds a very important treatment for unraveling or undoing that autoimmunity. For example, people may have heard of the bacterial infection known as H. pylori or Helicobacter pylori. This bacteria can cause ulcers, heartburn, reflux. It may even cause chronic like burping or indigestion. And this bacteria, when treated in patients with thyroid autoimmunity, has been shown to cause the thyroid autoimmunity to dampen quite a bit. So this is another example of how the gut has a very strong impact onto the thyroid, and by improving gut health, we can see quite miraculous improvements in thyroid health. And I've even done a few video conversations with some of my patients that are out there on the internet, where after improving gut health, we'll see a patient be able to decrease their need for thyroid medication in half, or we'll see their thyroid autoimmunity go from, you know, quite severe to quite dampened. So, you know, there's definitely both published and anecdotal information to support that position. But you know, the thyroid autoimmunity is probably the chief item that people should have addressed or have examined should they be hypothyroid. But there's also this, what if you're not really hypothyroid? And some people, if they've gone to their doctor, they may have had the conversation with their doctor or noticed on their lab work that one of my thyroid markers is a bit off, but the other one isn't a bit off, and you need to have both of these markers off in order to truly be hypothyroid. This is TSH and T4. Mm-hmm. If TSH is elevated and T4 is depressed, that diagnoses hypothyroid. But if just TSH is elevated and T4 is normal, that's kind of this gray area condition known as subclinical hypothyroidism. And this can be very confusing to patients and to doctors because you're not fully in the hypothyroid box, but you're not fully in the normal box. And so then what do you do in that position? And an important aspect is not to overtreat. If the treatment for hypothyroidism is oftentimes thyroid hormone, then what do we do for subclinical hypothyroidism? Does that mean everyone with subclinical hypothyroidism should be put on thyroid hormone? And no, it doesn't, because if you overtreat with thyroid hormone, this can cause other problems like cardiovascular problems, bone loss, insomnia. And so we don't want to overtreat either. So we'll lay out some guidelines for helping people to navigate if someone is subclinical hypothyroidism. Should you be treated? Should you not be treated? And again, this will be information that will be accessible for just a regular layperson or a clinician. Everything will be explained in very accessible language. And then a third piece is the iodine piece. I'm sure if people have looked into thyroid health at all, they've heard something about iodine. And there's a lot of confusion around iodine. And I think the confusion results from people on the internet who are writing about iodine and thyroid health potentially not always fully understanding how to use scientific research. And what I mean there is we may see in a very small group of people, they were iodine deficient, and because they were iodine deficient, that caused hypothyroid. And then when these people were given iodine supplementation, their thyroid function normalized. That is then extrapolated to say that if anyone is hypothyroid, they should take iodine, even if they're not iodine deficient. And this can be extremely problematic because the body of scientific evidence is pretty clear that iodine can be quite detrimental if the dose is too high for too long on thyroid health. But we have to go through an examination of the higher level scientific research looking at population studies and what happens in populations when they become overly exposed to iodine. And the short take home there is there's fairly, irrefutable evidence that if you are exposed to high levels of iodine for a long period of time, the risk for thyroid autoimmunity goes up quite dramatically. Right. So it's important that just because someone is hypothyroid, they don't just jump and reach for iodine supplementation, because there's a chance that if you have thyroid autoimmunity, you could make that thyroid autoimmunity worse. And even conversely, low iodine diets have actually been shown to reverse hypothyroidism in some cases. So there's definitely some important context there with iodine. And then finally, back to my earlier point, if someone is iodine deficient, then iodine supplementation will be a good idea. But again, it's this, not having this one size fits all recommendation and saying, oh, you're hypothyroid, you should take iodine. It's a little bit more patient or person centered, which would be, if you're hypothyroid, let's first rule out if you have thyroid autoimmunity and treat that. And then also rule out if you're iodine deficient. And if you are iodine deficient, we'll give you iodine. If you're not, we'll try to avoid at least excessive intake of iodine, because that might make the problem worse.
Absolutely, because this whole area is very nuanced, and there's so many kind of subtleties to it that it really does take a doctor to look into this and sort of give you an individualized approach for that. Now, something that is kind of a bit of a hot topic in thyroid health is carbohydrate consumption. What are your opinions on how much of a role does carbohydrate consumption have on thyroid health?
Well, that's another area, and I hope you don't mind me mentioning the podcast, Sam, but I want to direct people there.
Not at all, man.
Okay.
So good.
Because I try to give it a 3 or 4 minute answer here, but in the podcast we did a whole 45-minute podcast discussion on this that has all the supporting references there and is fully transcribed, so it's a nice resource for people. But that is available on my website. If people go there and just type in thyroid, they should see that come up fairly high in the feed.
And that's drruscio.com, isn't it? DRRUSCIO.com.
Yes, thank you. The shorter story on carbohydrate is there's some information out there circulating that says that if you eat low carb, that can be damaging for your thyroid, or it can provoke hypothyroid. And so let's look at that statement. Can it be damaging for your thyroid? No, there's no evidence to suggest that a low carbohydrate diet will damage your thyroid. Damaging the thyroid occurs through this autoimmunity that we discussed previously. And there's no evidence to suggest that a low carbohydrate diet will cause thyroid damage. Now, the other part of that statement, can it cause hypothyroid or slow down your thyroid? There's some evidence to suggest that a low carbohydrate diet can cause shifts in your thyroid hormones that may look like hypothyroid, but this only really occurs if you're on a very, very low carbohydrate diet for a very long period of time and you're underneath a certain caloric threshold. And there's something that a group of researchers, I believe, termed the caloric ceiling, where as long as you make sure to eat, I believe it was 800 calories a day or more, then these deleterious changes don't seem to occur. Right. And the other thing that I should mention is that these changes are likely just your body shifting to a different diet. So your hormones shifting slightly as a diet changes, and not necessarily a cause of hypothyroid. And maybe I can state that a little bit more clearly. If you went on a low carb diet and the low carb diet caused hypothyroidism, we would then expect someone to exhibit all the symptoms of hypothyroidism. But in many cases, in these studies, when people went on a lower carbohydrate diet, they lost weight, their energy improved. So it doesn't really fit that it's causing hypothyroid, because if someone was becoming truly hypothyroid, why would they be losing weight and having their cholesterol levels lower and their energy get better? But rather, what happens is when you change the balance of nutrients in your diet, you can see hormones shift in response to that. There is one caveat, and it comes back to my earlier point, is that everyone has a slightly different metabolism. So if you are someone that genetically should be eating a little bit more carbohydrate and you're on a low carbohydrate diet for a very long period of time, that may cause you to have some fatigue and other symptoms that look like hypothyroid. It won't cause true hypothyroidism. It's never been shown that carbohydrate load can cause true hypothyroidism in anyone, according to what I've seen, and I've done a pretty exhaustive review of the literature on this. But again, if someone has a metabolism that needs more carbs and they're eating a very low carbohydrate diet for a long period of time, that may cause them to have some symptoms. And an easy way to navigate through that is just to work through the model I introduced a moment ago, which is start a little bit lower to see if you do better on a lower carb diet, and then gradually increase upward and try to find what your ideal intake of carbohydrate should be.
Fantastic. That's great advice, Doc. And it's an absolute pleasure to have you on the show and kind of explain all this. But and I hate to reiterate this, but if you want to find out more, you should go to this weekend seminar that Refined Health are putting on with Dr. Michael Ruscio and Melissa Hartwig, sorry. Forgot her last name there for a second. You can find out more information about that, as well as sign up if you go to smashthefat.com/refind, REFIND. And if you want to find out more about Dr. Ruscio, you can go to his website, blog, and podcast as well. That's druscio.com, on Facebook under Dr. Ruscio, as well as on YouTube under Michael Ruscio, and finally on Twitter at Dr. Ruscio as well. And was there anywhere else where you wanted to point people to before you got to go?
No, I think you nailed it. I think that's a pretty good way to track me down.
Pretty much, yeah, that's right. We'll get you somehow. Right. Fantastic. That's it. That only leaves us one more thing to do, which is to shout, smash it out to the camera, which is something we do with absolutely everybody. So on the count of 3, I want you to shout, smash it out.
All right.
Cool. So 1, 2, 3.
Smash it out.
That's what I'm talking about. Guys, again, check out Dr. Ruscio's stuff. If you go to drruscio.com, drruscio.com, then you can find out all about him there. Then otherwise, Doc, I'll see you in London next month.
Can't wait. Look forward to meeting you. Thanks.
Absolutely. Thanks, Doc. Bye.
Bye-bye.